Hi, this is Mayor Teri Johnston. Welcome to 2021. In years past, I've given a presentation that went department by department to talk about accomplishments and what we hope to accomplish in the year 2021. But this year, we have all endured one of the most incredible, challenging years that we will ever face in our lifetime. So I'd like to do something a little different. I'd like to focus on our entire community this year. I don't mean to slight city staff because they've accomplished some great things in 2020. But our Public Information Officer, Allison Crean, has done an incredible annual report, which you can read online at www.cityofkeywest-fl.gov, or you can pick one up in our lobby from Aaron. So this year, what I'd really like to do is I would like to focus on our business community, on our financial community, on our emotional community, and our spiritual community, and what we're looking for in this year 2021. So let's start with something that we can actually measure, and that's the health of our community. In 2020, we had 2,111 positive cases identified in the city of Key West. I think we all realize that that number does not capture the visitors that we had that were asymptomatic, that came in and out of Key West, of our labor force who simply couldn't afford to take a day off of work so did not get tested, or those people who just haven't had a chance to get tested yet. We lost 35 souls in the county, most notably our First Lady, Cheryl Cates, who succumbed to COVID on December 2nd. We were fortunate to be guided through all these troubling times by incredible healthcare workers. Bob Eady from the Department of Health, Dr. Jack Norris, Dr. Bruce Boris, and Dr. Mark Whiteside. During week one of the pandemic, our healthcare professionals warned us that our overnight shelter presented one of the most vulnerable and potentially infectious populations that we have on the streets of Key West. So under the direction of our executive director, Alicia Pinaboni, our center was immediately converted to a 24-hour facility to offer a safe alternative to spending the day on our streets while offering 3 meals, testing, physical distancing, and sanitary precautions.
2020 held some really specific challenges as to how we supported the homeless residents of our community. In a very short period of time, we converted our overnight shelter to a 24-hour facility. We used to operate from 6:30 p.m. to 7:30 a.m., and now we are a 24/7, 365 days shelter. We also had to implement social distancing, so we needed to expand our footprint to be able to accomplish this. In an extremely short turnaround time, we mobilized the staff and resources needed to meet the needs of this vulnerable population in our community. We saw some really positive outcomes from these changes, including dramatically reducing indigent care visits to Lower Keys Medical Center. That reduces the strain on our community in multiple ways. We saw higher levels of clients seeking employment, and we also saw less incident reports within the shelter. The silver lining here is that we learned so much. The working relationship between us and the city has never been better. We learned how to operate a congregate shelter during a pandemic and a hurricane combined. We learned how resilient we are, and we have a deeper gratitude for being able to serve our community and some of our most vulnerable residents.
That strategic move had an immediate impact on our vulnerable residents by keeping them safe and dramatically reducing the number of ER visits to Lower Keys Medical Center. On March 17th, our governor suspended bar sales and 3 days later suspended on-premise food consumption for our restaurants, followed on March 24th by our checkpoint at mile marker 112.5. By April 1st, the governor had enacted our Safer at Home initiative, which basically limited all activities to essential services only. As layoffs grew and paychecks became sporadic, our labor force reached out for assistance and found a state unemployment system in catastrophic failure. Nonprofits like the Catholic Charities, Florida Keys Outreach, Metropolitan Community Church, United Way of Collier County in the Florida Keys, Sister Season, And SOS and many, many others immediately stepped up to fill the gap with food, rental assistance, and emotional support.
In April of this past year, I wrote to Archbishop Wensky. We were in confinement, we were broadcasting masses virtually, but the statistics that concerned me most were not just the cases of COVID, but during this time of confinement, of restriction, there was a 40% increase in domestic violence, an increase in suicides in Monroe County, an increase in drug overdosing, and an increase in alcohol poisoning. And children did not have the capability to mitigate the fear, the epidemic of fear that was overtaking our lives. And so we've been adapting, doing things we've never done before. What I found is that people are cooperative, they socially distance, we cordon off every other pew, they wear masks, they're deferential. It's working, and we just need to keep on adapting and making things work for the well-being of everyone.
Each Sunday, we incorporated a portion in our service, needs for the members. What do you need? What can we do? I was fortunate enough to work with Elisa Levy and the task force on Key West recovery. And each week I would say, there are resources there. We're trying to put things in place, but you have to tell me. It was not overwhelming, but eventually one or two members, a few members came to me with needs. And I was able to refer them to Elisa and others, Nadine, to get them assistance. And so we thank the city of Key West for everything that they have done to help. Some of our members have gone to the food banks and so forth, and that has been helpful. We continue to have needs. But we thank God for the resources that lets us know where we can go to find them.
During these uncertain times, our community sought spiritual and emotional support and healing. Maureen Dunleavy at the Guidance Care Center was awarded an $800,000 grant to provide free and low-cost mental health services for our residents.
Guidance Care Center was able to secure federal funding so that we could continue to provide more mental health treatment, more assessment, more crisis support, more outpatient therapy, more psychiatric services to help people that may be at risk of suicide. We know that in our community, many people are at risk of suicide, and COVID has increased that. So our goal is to provide services to anyone who needs it, and whether they could pay for it or not. In addition, with this federal funding, we're also going to be doing suicide prevention trainings so that individuals can learn about how to talk to people about suicide and connect them to the resources available. So the message for 2021 is that it's not hopeless. There is help available, and we'll get through this together.
With international travel banned, cruise ships halted, and a very uncertain tourism market facing us, our economic health was of great concern. Alicia Levy, who had been working with us on our strategic plan, came to us very early on, saying, "While it's nice to get started on our strategic plan, our house is on fire right now." And with that, Alicia immediately organized Key West Recovers.
So we were originally embarking on a long-term strategic plan for 3 years for the city of Key West. But this all came to fruition in the height of COVID. So we said, look, we need to stop and do a short-term COVID recovery plan for, that lasts for about a year, and then we can embark on the longer-term plan. And the way I described it to people was, the house is on fire, that's the short-term recovery plan. We're building a house, how do we want it to look? That's the long-term strategic plan. And we had to deal with the house on fire first. So we surveyed the community, we talked to a lot of people, we got a committee together, and I would say, and we developed a 17-point plan to help the community. It was divided into business help and community help. And I would say there were two big wins from that plan. One was food security. We were able you see a lot of cities right now are struggling with food lines. We were able to avoid that by working with the county and the city to present the exact precise nature of the problem. How much food did we need? How many people were needing it? How many children didn't have enough to eat on the weekends? And we got that taken care of. And we're actually good through March. And the second was just we raised funds to hire a consultant to get the word out to the community about all the resources that are available, especially to people on the fringe who might not know. And we've seen a huge uptick in people coming up for services, which is great. And then that leads us to the longer-term strategic plan, which we just are starting literally today. We launched the community survey, and I got 718 responses so far in one day, and that matters. What our community tells us is the basis of this longer-term strategic plan. So they feed into each other, and hopefully they'll just keep us moving forward as a city.
She volunteered her time to organize and facilitate 20 roundtable discussions, engaging over 250 community members from every facet of Key West. These discussions culminated with an interdisciplinary task force of 11 people who on October 20th made 17 recommendations to the City of Key West to address our most pressing economic and humanitarian needs. To date, I'm so proud to say that every single one of these recommendations, with the exception of 3 that are in process right now, have been completed. Our goal was to create a 6 to 18-month plan that could move our community faster towards a state of stability while maintaining our most critical need, the health and safety of our residents. The task force now moved on to getting all this critical assistance out to the people who actually need it. And that's where Nadine Grossman-Orr came in.
Being a part of the Recovery Task Force has been a huge honor for me. What a great opportunity. I volunteered my time as a part of the task force, and one of the biggest things we realized was that we needed to communicate all of these amazing resources that we already had available to the community right here in Key West. So that's where I jumped in. I knew 30 years living here in Key West that I was connected in the right places to the media, to the news, to the radio, and I could take what I knew and my network and put together all these pieces. And what an experience I had working with these nonprofits who are amazing, by the way. I was in tears and elated and delighted and so thrilled with all that I learned with working with these nonprofits, and to be able to connect them, and then most importantly connect them to the community who needed these resources so desperately right now. And it was a lot of people in the community that hadn't had to reach out for help before. So such an honor. My dedication and my time and my love of this Key West community, it was such an honor and a gift for me to be able to use my network and connect everyone to these critical resources for recovery.
The Small Business Development Center stepped up to help our businesses survive in this new market. Local consultants from the SBDC helped owners rewrite their business plans and help them procure grants and low-interest loans to keep them afloat.
So our role at the SBDC was to directly assist businesses. Between March and late summer, I was working with businesses that I had been, in many cases, working with to grow their business on a normal day, was now directly assisting with applying for disaster loans of various sorts, and also helping folks who had applied perhaps for an EIDL loan and were denied, getting them reconsidered so that they would successfully get that money and be able to move on. And then a big part of that too was pivoting to whatever needed to change about their business model. At the same time, we were dealing with a lot of the chambers too. We're a member of every chamber, and we were getting information, updates out on a constant basis as the loan situation was evolving, as resources were evolving, both at the state and at the federal level. So now I'm happy to say that going forward into 2021, I think this has been a little bit of a wake-up call about being so wedded to just tourism for our economy. We need to diversify, but our team is ready with the expertise. We now have access to 25 people total on the team for businesses to work with, and we also have 5 people specifically in the Keys that are dedicated to working one-on-one with businesses to help them grow.
The city worked closely with the TDC to get the visitor messaging correct and increase signage to communicate the safety measures required when you enter the city of Key West. Key West was recognized as one of the fastest recovering communities in the United States and was named one of the top 2 destinations to winter in this year. By October, our sales tax revenue had rebounded to 102% of our previous year, and in September, our 4-penny bed tax revenue numbers outperformed our 2019 totals for the first time after 6 long months of negative trends. Unemployment in the city of Key West rebounded from a record 17.7% during the 2.5 months that we were on lockdown to the 4.6% that we ended up December with. We are still concerned about the numbers of our labor force who have left the city of Key West. And I want to put this number in perspective because normally in the month of December we are at 1.9% unemployment rate. The city continues to rebound quicker than anticipated, but not without sacrifices by every city employee and every city department.
In a non-pandemic year, I think the challenges that routinely face the finance department are generally pretty fast-paced. 1, closing out the city's financials, and 2, putting forth a budget that is both sensitive to the eternal needs of the city and likewise to the community is always a challenge. 2020 presented extraordinary challenges as a governmental unit in that we were anticipating revenues to be rather suppressed from prior years, so we had to find ways to make that up. A majority of that was made on the backs of either 1, suspending over 30 positions, 2, taking some transfers from other funds that we normally would not traditionally take, and 3, cutting out any of the operating requirements that, though needed, could absolutely wait for another year. And then also addressing any of the capital needs on the equipment side, and we basically deferred all capital equipment needs for another year. We did not neglect reserves. We're trying to build up the reserves a little bit through the year, and at the same time we were able to achieve millage rollback, which was very important to not only the commission but important to the community in that we can now, during their economic hardships, at least say that we didn't burden or add to those economic hardships by adding additional taxes. It's important to note that we also did turn around and address some of the community's needs by taking some of the city's reserves and addressing some of the rental, the utility, and the food, and the testing needs of the community by taking some of our reserves and pushing that back out to some of the nonprofits in the community.
Not all businesses struggled, however, during this pandemic. Our residential real estate in the city of Key West saw healthy gains, with cash buyers snapping up inventory after a virtual tour.
I am the 2020 president of the Key West Association of Realtors. It has been my pleasure to lead our organization through these unprecedented times. We are very grateful to be blessed with a vibrant residential real estate market. Through application of the technology, we have experienced an extremely robust real estate sales and listing marketplace. Many of our clients have decided to upgrade to purchase a larger home, necessitating an in-home office or 2, which opened up the marketplace for smaller, more attractively priced homes to be available for locals. Thank you, Mayor Teri and the City of Key West staff for all you do to help us navigate these turbulent waters and to keep us safe. Cheers and a very happy new year to all. Thank you.
Our commercial real estate market, however, faced very different challenges.
The COVID-19 pandemic placed extreme pressure on our commercial real estate market. It put extreme pressure on our businesses, which when March happened, they were just completely shut down or barely operating. We were able to get back going to some extent, but never really got going strong until just a few months ago. And some businesses still haven't been back to where they were pre-COVID. But overall, we're seeing restaurants doing okay, we're seeing some retail doing okay, we're seeing our lodging properties coming back okay. So overall, we're seeing a recovery happen in Key West, and I think that's a great thing all around for everyone. downtown is still hurting, and it's good to see lots of visitors back here filling our streets, but we're going to get back. Key West is a very strong and resilient place to do business. It is always the first to feel the effect, but it's always the first to come back strong. So I do believe, looking at my crystal ball for 2021, that we're going to continue to have more visitors come visit our island, and our restaurants are going to be doing okay. Our lodging continues to get a little better. Seems like every week they're doing a little better, and our retailers are figuring out a way forward, and that's what everybody's done. Even landlords, we had to work with tenants. We had to work with the tenants, and we had to figure out a way forward for them, and so in many cases we did. For instance, I haven't dealt with one landlord that kicked out a good tenant. We've worked with tenants that had major struggles. We've got some gyms. We have lots of small restaurants that social distancing was very difficult because they're only allowed so many tables. So anyway, I'm optimistic about 2021. Let's keep up all the good work.
And if a global pandemic was not enough, the city faced additional unforeseen challenges. In September, we withstood a ransomware attack on our city servers.
Well, this past year has given us quite the challenge, and one for the City of Key West is obviously the computer virus that we were faced with, and I think we met that head on. From the first day, we were in touch with the important officials that we needed to be in touch with. We dealt with the situation as far as how to move the computers and the data, and it took probably from start to finish 6 to 8 weeks to complete most of the restoration. What I would focus on now is what we've done to improve the cyber attacks that we're all facing, in this country and other countries as well. We've set up a new training session for our employees, and our orientation. Most of our people have to go through the training. All of them have to go through the training, as well as we set up a monitoring software for 24 hours. So those are good things that's happened since this attack, and we were 99% successful with our data.
This City Commission made some of the most difficult decisions we will ever make. We debated and we disagreed, but we stayed united in our focus of protecting our community and rebooting our economy. We learned to appreciate the silver linings during this pandemic, like Stephen Sunday painting trees in our historic cemetery, Simonton and Duval Streets finally getting paved. We welcomed a new healthcare clinic to service the residents of Bahama Village. Our Boys and Girls Club finally moved in to their new location at Bayview Park after 13 years. A.H. Monroe opened up Marty's Place with 47 new affordable housing units, all under $1,100 a month. And our girls softball diamond at Rosa Hernandez now has new artificial turf. And in true Key West spirit, we held truly peaceful protests. We burned flags, and new businesses opened up during this pandemic. So what's ahead of us? With the incredible help of AHEC and Michael Cunningham, we now have over 3,000 free rapid tests out there to keep our service workers working every single day in the city of Key West. We're getting in more and more vaccinations every day, and although it didn't go as smoothly as possible, every single one of us is going to be vaccinated shortly.
The good news for 2021 is that the City of Key West is moving forward and has provided funding for more rapid testing to be available at no charge for employees and for citizens of Monroe County. More details will follow as it's fleshed out, and the really good news is that vaccine for COVID is now flowing into Monroe County. It's still a real work in progress because there's not a really steady supply nor a real schedule of when we get what. But the good news is vaccine is starting to flow. We have vaccinated over 1,300 people in Monroe County that are either frontline medical personnel, 65 plus, or emergency medical technicians.
We are still going to be meeting the needs of those people who experience food insecurities.
The City of Key West immediately responded and offered to help, and we could not have responded and done what we did without their assistance. They offered the community services people that helped us stage the distributions. They offered financial support to SOS as well as a number of other food pantries in town, which particularly during the height of the shutdown was significant and absolutely needed. Financial assistance to buy the tremendous amounts of food that were required at these distributions, where we were distributing as much as 35 tons of food at each weekly distribution. The city, more than any other municipality, was conscious of the impact on their citizens and did everything that they could to try to reach out and help the various social service agencies that are tasked with responding in these situations.
As we know, this COVID-19 pandemic has taken an economic toll on our community, hurting both businesses and residents alike. According to United Way's Alice report, over 1/3 of our residents were already struggling to make ends meet, living paycheck to paycheck even before the pandemic. So the financial consequences of COVID-19 have been severe. Social service organizations report seeing a need unlike anything they've ever seen, even after a hurricane. These significant challenges have continued for months. This leaves many in our community struggling even more so in the coming months, allowing our most vulnerable residents to slip either further behind and continuing to see our workforce further diminished without immediate stopgap measures in place. So the group of community leaders created a stopgap proposal for $381,000, requesting that the city step forward to support these measures, helping our residents be healthy and safe. And the City Commission unanimously agreed, going even one step further, to pass a resolution for up to $500,000 to help our residents. The City Commission recognized that to keep Key West open, safe, and economically stable, people need to have safety nets, such as food and emergency financial assistance. This will reduce COVID spread and stabilize our community. United Way will be partnering with the city for $209,000 of this generous assistance. We will be helping community members with life's most basic needs of rent, food, utilities, and medical care. You can visit keyshelp.org for more information and a comprehensive listing of COVID-19 resources and programs available.
So here's my takeaway as mayor in my third and most tumultuous year. We've endured, at times more gracefully than others. We've remained committed to protect our residents, and whether we agreed on the mechanism or not, we have never wavered in our fierce support of our locals. I'm proud to be part of this city government who, without hesitation and in very uncertain financial times, stepped up to donate $165,000 to augment food supplies for our nonprofits. We wrote a check for $65,000 to the United Way of Collier County and the Florida Keys for rental assistance for the Key West workers. We abated and deferred over $1.2 million in rent for our city tenants to withstand the storm, and we continue to support our community with over $500,000 in financial support for our workforce to get us through this pandemic. We've been able to balance the health of our community and the health of our economy, and we're going to need to continue this fragile balance as we move into perhaps 3 of the most difficult months ahead of us before we can see actual relief and true protection against this virus. What I do know during these uncertain times is that we live in the most incredible, caring, giving community imaginable. I'd like to close today with a quote by Margaret Wheatley. "There is no power for change greater than a community discovering what it cares about. We care about each other." Thank you.